Okay, uh, guys, so we will discuss about the cortisol. Okay, cortisol and its analog have powerful effect on glucose metabolism. Okay, cortisol and its analog have a powerful effect on the glucose metabolism, and all collectively classified as glucocorticoids. All collectively classified as the glucocorticoids. Although they do have some mineralocorticoid action, cortisol is secreted from zona fasciculata of the adrenal cortex. Okay, normally the mineralocorticoid effect is done by the zona glomerularis, but here the cortisol is secreted by the zona fasciculata, and it's also have some mineralocorticoid effect. Okay, so what we have seen that the cortisol and its analog have the powerful effect on the glucose metabolism and collectively classified as the glucocorticoids. Okay, and it is secreted by the zona fasciculata of the adrenal cortex. As we have seen earlier, that this is the adrenal cortex. Outside there is the this is the adrenal gland. Okay, this up to this is the cortex, and this is the medulla. Okay, so in the cortex it is divided into three parts: the zona glomerularis, zona fasciculata, and the zona reticularis. Okay, and here the medulla. Okay, so this cortisol is secreted by the zona uh, fasciculata, which is in the middle side. Okay, and its powerful effect on the glucose metabolism and collectively classified, so it is collectively classified as the glucocorticoid. Okay, so regulation of cortisol secretion in the health. Okay, regulation of how the cortisol secretion is regulated. Okay, so we will see that the cortisol release is stimulated by the adrenocorticotropic hormone, ACTH hormone. Okay, cortisol release is stimulated by the ACTH hormone from the anterior pituitary. Okay, ACTH is secreted from the anterior pituitary, and it stimulates the cortisol secretion, which in turn is released in response to corticotropic releasing hormone. Okay, and in due to ACTH, it releases the secretion of the corticotropic releasing hormone from the hypothalamus. Cortisol has a negative feedback effect on the hypothalamus and the anterior pituitary gland. Okay, inhibiting the release of the corticotropic releasing hormone and the ACTH respectively. Okay, so we have learned that the ACTH secreted from the anterior pituitary. Okay, and it will increase the secretion of the corticotropic releasing hormone from the hypothalamus. Okay, and this corticotropic releasing hormone will increase the secretion of the cortisol from the from the adrenal zona fasciculata. Okay, in the adrenal cortex. Okay, and this cortisol has the negative feedback effect on both the corticotropic releasing hormone and the ACTH. Okay, so if the cortisol will increase in the blood, it will inhibit the release of the corticotropic releasing hormone and the ACTH, and it will decrease ACTH and the corticotropic releasing hormone, and will further decrease the release of the cortisol. Next, the effect of the cortisol are mediated by intracellular receptors that translocate to the cell nucleus after binding the hormone. Okay, the effect of the cortisol are mediated by the intracellular receptors. Okay, it is mediated by the intracellular receptors that translocate to the cell nucleus after binding to the hormone. Cortisol is released during the course of normal physiological activity in the pulsatile pattern. Okay, it is released during the normal physiological activity in the pulsatile pattern. Okay, it is secreted in the pulsatile pattern. Cortisol release display a circadian rhythm with the highest level in the early morning. Okay, it's display the circadian rhythm and its highest level in the early morning. Okay, in early morning the cortisol has the highest level in the circulation. Now, regulation of cortisol secretion in the stress. Okay, so regulation of the cortisol secretion in the stress, how it's regulated in the stress. So the primary stimulus for the increased release of glucocorticoid is stress. Okay, primary stimulus is the stress for the glucocorticoid, which is the result of exposure to adverse stimulation, which is the result of exposure to adverse stimulus. Stress response is driven by the amygdala part of the forebrain that stimulates. So stress response is driven by the amygdala. Okay, it is the part of our brain. Activity in the hypothalamic corticotropic releasing hormone. uh, it so what described here, that the stress will stimulate the hypothalamic corticotropic releasing hormone. Okay, then activity in the sympathetic nervous system. Okay, then activity in the parasympathetic nerves that cause the acid secretion in the stomach and the feeling of fear. Okay, this activity will stimulated by the stress. Okay, then the action of two part of the adrenal gland are completely in response to stress. Okay, which two part are completely in response to stress? So the catecholamines are released from the adrenal medulla to produce a rapid increase in the cardiac output and the mobilization of the metabolic fuels. Corticosteroids produce a slower, more sustained response. Okay, I have two parts in the adrenal glands are completely in response to stress, catecholamines. Okay, and catecholamines and corticosteroids. Catecholamines are released from the medulla, will increase the cardiac output, rapid increase the cardiac output and mobilization of the metabolic fuels. Okay, and the corticosteroid, which is produce slower, more sustained response. So, what is the effect of cortisol? Cortisol acts to raise plasma glucose by stimulating glycolysis and gluconeogenesis. By stimulating the glycolysis and the gluconeogenesis, okay, the cortisol will increase the glucose in the liver and inhibiting the peripheral glucose uptake to the storage tissue. Okay, so in the liver it is increase the glycolysis and the gluconeogenesis, and in the periphery it inhibit the glucose uptake into the storage tissue. Okay, it inhibit the glucose uptake in the storage tissue. Okay, then which other effect? So the increased protein breakdown in the skeletal muscle, skin and the bone to release the amino acid. Okay, in the bone, skeletal muscle and the skin, the protein breakdown will increase to release the amino acid, increase lipolysis from the adipose tissue to release the fatty acid. Okay, increase lipolysis in the adipose tissue to release the fatty acid, and at higher level mimic the action of aldosterone on the kidney to retain sodium and water and loss of potassium ion. Okay, retain sodium and water and loss the potassium. So in the higher level it mimic the action of the aldosterone and suppress the action of immune cell. Okay, it suppresses the action of the immune cell. Okay,